Well, good morning, everyone. Thank you for your presence at our press conference today, marking the occasion of the Community Confidence Tour by a White House delegation. And so on behalf of Mayor Frank Scott Jr., it's our pleasure to welcome you to this conference this morning. We are, of course, at Stevens Elementary, which community school. So thank you so much to the Stevens Stevens Elementary family for hosting us this morning. Principal Carlock, thank you so much. And of course to our LRSD partners in this effort. I am Stephanie Jackson, spokesman for Mayor Scott, who could not be here this morning. The mayor was invited to attend President Biden's signing of the bipartisan infrastructure bill at the White House this afternoon. He sends his regrets, of course, but is thrilled to represent our city in the nation's capital as Little Rock stands to receive tens of millions of dollars for roads, bridges, broadband, which is even a need here in Little Rock, and so much more, of course. So we'll get to the reason that you all are here today. Dr. Deion Jackson, Little Rock's Chief Equity Officer, will be coming to the podium at this time to give us more details about today's visit.
Good morning. It's indeed a pleasure to be with you this morning as we have the opportunity to welcome our guests from the White House. I'm excited about the great conversations that we had this morning regarding COVID response and equity in our city, and I'm excited about what our guests will see here at Stevens Elementary. As a part of their Community Confidence Tour, our guests are present to learn more about how we as a city have followed the science when dealing with COVID-19, the pandemic, and our response. It is our pleasure to host guest Dr. Cameron Webb, who serves as the Senior Policy Advisor for Equity for the White House COVID-19 response team, Dr. Aaliyah Samuel, who serves as the Deputy Assistant Secretary, Local, State, National Engagement for the U.S. Department of Education, Mr. Theron Pride, who serves as the Deputy Associate Attorney General, U.S. Department of Justice, and we also have a special guest, Mr. Ross, who's with the U.S. Department of Justice representing the Eastern District. We are thoroughly excited for them being present today for this multi-city tour. Throughout our day today, it is our hope that they will gain valuable information regarding the impacts of COVID-19 on our community and the ways in which we have collaborated to support and protect our residents. As Stephanie mentioned, we do appreciate the Little Rock School District and the Arkansas Department of Health for partnering to provide today's vaccination clinic. Equity teaches us that the distribution of resources must be in a manner that is effective for access for all. Vaccine clinics like today are perfect examples of health equity, serving kids where they are to provide them with healthy futures. Today's clinic is just one example of many partnerships that exist within the city of Little Rock and the state of Arkansas to ensure that science leads the way in protecting our residents. We continue to be grateful for all who have partnered with us to work tirelessly to do so to protect our residents. Now I will turn it over to Dr. Webb, who has further information about their visit on today.
Thank you, Dr. Jackson, and good morning, everybody. It's truly my pleasure to be here with you today here in Little Rock. You know, we started these community confidence visits over the summer, and the context was that we had been traveling around the country to talk to people about vaccinations. And we really quickly learned and saw just how important it was to put the COVID response effort and, yes, the vaccination effort in its proper community context. We were at a barbershop in one city, and a gentleman mentioned that even though he doesn't know anybody who had passed away from COVID in the last few weeks, he knew several young people who had been murdered due to community violence in the last few weeks. And he wanted to make sure that we were having both of those conversations at the same time. And that was the inspiration for these visits that have now taken us to South Carolina, North Carolina, to Florida, Georgia, and Alabama, to Louisiana, here to Arkansas. We've been to Wisconsin and to Illinois and also to Michigan. We've been to so many different communities having the same kind of conversations. We start by asking leadership in the community, what are the core issues that are of import in your community, whether it's housing or food access or community violence or education, and how can we put the pandemic in that context? And it's been really helpful in informing the way that we respond as an administration, and it's been really helpful in informing the way that you all are able to reach and engage with the federal government. So I just want to extend my sincere thanks to Mayor Scott for inviting us here, for giving us this opportunity to hear from you, to learn from you. Because trust me, what you all share with us from Little Rock is going to resonate with a lot of other communities as well. It sharpens our ability to respond in this COVID pandemic, and so we're really grateful for the opportunity to do so. Now, I'll conclude by saying that today's visit, the context that we were engaged with is really around community violence, understanding that that's something that a lot of communities are dealing with. And so part of what we do is we bring leaders from across the administration who can share some of the resources that we have and some of the other learnings that we're seeing from communities across the country. And so I'd like to introduce my colleague, Mr. Theron Pride, who's joining us from the Department of Justice. Mr. Pride.
Thank you, Dr. Webb, and I'll reiterate the thanks both to the mayor and to the chief. Being here in Little Rock is important for this conversation today. As we mentioned, it's not only about the COVID-19 pandemic. We know far too many jurisdictions, cities are dealing with the epidemic of gun violence. And earlier this year, both with the President and the Attorney General, this administration made a commitment to focus on this epidemic while we also focus on the pandemic. Far too many lives are lost by gun violence, and our kids are hurt by that. It leaves a wake of pain for many in the community. And we know that we can't arrest or prosecute our way out of it. I'm joined by my colleague today, who's the acting Assistant Attorney General, Assistant U.S. Attorney here for the Eastern District, Jonathan Ross, and he will tell you as well that we know that we can focus in on the individuals who we know are driving the violence. It's often a small group, but that in of itself is not enough. Many communities need resources and additional supports. And so back at the Department of Justice in Washington, D.C., in my portfolio, there is the Office of Justice Programs, the Office on Violence Against Women, and the Office of Community-Oriented Policing Services, the COPS office. And as the Deputy Associate Attorney General within the Office of the Associate Attorney General at the Department of Justice, we oversee nearly $5 billion in resources to support state and local law enforcement and other community, nonprofit, and units of local government to address public safety challenges. And so we're here today to also talk about what more can we do. The Deputy Attorney General, along with the Attorney General, made a commitment of trying to reinvigorate what folks might be familiar with as Project Safe Neighborhoods, which is really looking about working with state and local law enforcement and other community partners to focus in on the individuals who are most likely driving the violence, and also thinking about the community aspects that, again, fuel and drive the violence. And in the conversation we had this morning, it's clear that it's not just about individuals having access to weapons. It's about individuals not having access to being able to meet their needs. Hunger, not being able to have the social services and the counseling, not being able to have access to other stable supports. People need mentors. Young people need a place to go and talk about what bothers them, what troubles them. That's not often easy. And far too many parents are also dealing with the trauma that has been caused by the pandemic, as people have lost loved ones, as they've lost jobs, as they've lost other supports that are needed. So it's a really difficult time, and as we battle our way out of this pandemic and as we come out of it, we know that we'll be facing a new set of problems as our kids, as we've already heard, coming back to school with further challenges and trouble. So that is where, again, the Office of Justice Programs, the Office on Violence Against Women, and the COPS Office can play a role by actually providing resources, not only in terms of dollars, but in terms of training and technical assistance to help community organizations, law enforcement, and other partners figure out a plan, a comprehensive plan to address the violence. And the good news here in Little Rock is that that work is already happening. There's already folks who are at the table with the chief, with the mayor, with the U.S. Attorney's Office, bringing together the necessary partners to focus on this work in a comprehensive way. And I was delighted to hear, and will certainly be working with the acting U.S. Attorney, as well as the chief and the mayor, to figure out what other things we can do back in Washington to further support the good work that we see. And so I would tell people, don't lose hope. We know that this is an issue that a number of cities are dealing with, But in Little Rock, you are actually making a difference. There is gains, there's progress being made, and I think to stay the course and to continue to build those partnerships, as the city manager said today, it's not always just about the funding, it's also about making sure the resources get to the people who are most in need. And so again, that is a problem that can be solved, and I think together we can get there. And I look forward to working with many of the folks here in the months ahead. Thank you. And I'll turn it over to Dr. Samuels.
Thank you, Mr. Pride. We will now hear from Chief Humphrey from the Little Rock Police Department.
Thank you, Dr. Jackson. Good afternoon. Good morning, everyone. You know, you've heard me say this quite a few times over the last few weeks. It is not a public safety issue that we're having throughout the nation when it comes to the increase in violent crimes. It's a public health issue. And you've asked me, what does that look like? That looks like all the entities coming together to realize that we have to look past the numbers. Sometimes people focus on the numbers. They focus on the numbers of shootings, the number of homicides, and I understand that. That's just what you do by nature. But it's come a time in the nation, and especially here in Little Rock, we have to look at what causes, what are the underlying causes of those numbers. And I want to tell you just a quick story. When you talk to young people, and we're seeing an increase in our young adults involved in our violent crimes, and we're talking 15 to 23 years of age. And when you talk to a 21-year-old young man that has a lot of influence, very positive young man, may have gotten in a little bit of trouble, nothing major, but a very sharp young man that understands life, and he's had to grow up pretty fast. And when you talk to a young man and he tells you about how he's attempted to get a job more than 30 times, he's filled out the applications, he's done everything that we've told him to do, worn a nice pair of slacks, worn a nice shirt, worn a nice pair of shoes, presented himself in a very professional manner, respectful manner, and he can't even get a call back. And so and when you ask this young man, what are you looking to make per hour? And when he sits there and looks at you and tells you, I just want to make minimum wage, and all I want to do is be able to help pay a utility bill. All I want to do is be able to help buy groceries. All I want to do is be able to buy my mother or my grandmother something very nice. All I want to do is be able to buy myself a nice pair of tennis shoes and make it and contribute to the household. But I'm unable to do that. So if I'm unable to do that, if a child is unable to do that, then they go to the next step, and that is, I'm going to get it by any means necessary. We have to come together, and it seems that we're doing that. Well, it doesn't seem. We're doing that in the city of Little Rock. I've said it over and over again, conflict resolution. I've said it over and over again, public health. That's what we have to do. We have to continue to convene these professionals in each discipline to come up with a plan. We've got to have the social programs. We've got to have the education. These provide strong education and the respect for each other. That is the only way that we're going to see our violent crime drop, not only in Little Rock and throughout the nation. And so I want to commend everyone for being here today to assure the citizens that we're headed in the right direction, and that every day is a conversation regarding the reduction of violent crime and how we increase our public awareness. And just in closing, what I'd like for someone to do, reach out to, we had the mother of a victim at our round table this morning. Somebody needs to hear her story. Someone needs to take the time to hear her story and the story of others that have who are affected by violent crime. Causes collateral damage. And someone needs to sit down and listen to them and ask them, what do they think would help? Don't try to find solutions for them. Let's bring the survivors to the table. They have a story and they have a solution. So thank you all. Have a good afternoon.
Thank you, Chief Humphrey. We will now hear from Mr. Ross.
Thank you, everyone. You know, equal justice for all means that some neighborhoods shouldn't be more safe than other neighborhoods. That requires a commitment and a resolve by the Department of Justice, our federal law enforcement partners, and our state and local law enforcement leaders to come together and share resources, share strategies, and roll up our sleeves to make sure that when criminals engage in violent crime, they know that the consequence will be significant enough to deter that crime. You know, in 2016, Attorney General Loretta Lynch came to Little Rock to host a nationwide Violence Reduction Network Summit. And since that time, this community, this district has been committed to working with our federal and local law enforcement partners. And I'm happy to say that the U.S. Attorney's Office for the Eastern District of Arkansas has the 6th highest caseload per Assistant U.S. Attorney in the country. The 5 districts that have a higher caseload are the Southwestern Border Districts, which each deal with a significant influx of immigration criminal issues. And so that means that the Eastern District of Arkansas has the highest caseload in the country per federal prosecutor where there are not significant immigration issues. That comes with over half of our caseload being in the category of gun violence and Project Safe Neighborhood cases where we adopt state and local cases for federal prosecution. That partnership could not have been as successful as it has been over the last several years without the resources of the City of Little Rock, the Little Rock Police Department, as they both day in and day out work with our federal partners to identify cases that are appropriate for federal prosecution. They also commit significant resources through the form of task force officers that the City of Little Rock employs, who then go work for the FBI, DEA, and ATF to make sure that we have the greatest resolve and commitment of resources available to work these kinds of cases. That said, given our significant increase in prosecutions over the last 4 to 5 years, we still have a violent crime problem, which means that prosecution alone is not the answer. It is a significant part of the answer, but the programs that they are here to highlight today from DOJ and from the different partners who are here with me, I would just say that the information I'm sharing serves to as a proof that rolling up our sleeves and working with our local community stakeholders is also an essential part of trying to address and bring equal justice to all neighborhoods. And so I'm proud to be a part of this group here today and proud to continue the public pronouncement of our resolve to continue our PSN program here in the Eastern District of Arkansas. But we are looking forward as the pandemic starts to shift in all of our safety protocols, the ability to work again with our community stakeholders in social services and reentry programs and the different partners who are trying to be a part of the answer to providing different solutions and different options to those who might otherwise engage in community violence. And so that's an important next phase that we will work on over the next coming months and year. And of course, the Department of Justice has issued a guidance to every U.S. Attorney's Office in the country to further bolster their violent crime reduction programs. And a key component of this program is to engage in community violence intervention programs. And so we look forward to this discussion that's being had today as we do work on, again, bringing equal justice to all neighborhoods. Thank you.
Now we're grateful to hear from Dr. Samuel. Following Dr. Samuel will be Superintendent Mike Poore.
Good morning, everyone. It is truly a pleasure to be here at an elementary school. As a former elementary principal, it's fascinating to see how reopening of schools has been handled across the nation. I've had the great fortune of being Dr. Webb's partner in travel in a lot of these community conversations. And one of the things I will say that this administration has been very clear on was the importance of reopening schools. And so during the first few months of the administration, the entire focus was how do we make sure that every child across the United States has access to 5 days a week in-person learning, because the secretary and the deputy secretary recognize how important schools are to not only children, but to parents, to families, and communities. And with that, I can tell you it's with great pride that the administration can share that 97% of the schools across the nation are open. And the reason why they're able to be open is because of all of the efforts that have been put in to ensure educators are vaccinated, parents are vaccinated, that mitigation strategies are there and in place, because it's not only important to make sure that we are returning to in-person schools and schools are open, but that they remain open. Which is why I was so happy to come down and travel, and actually had an opportunity to talk to some parents in this vaccine clinic, because these youth and child vaccinations will be so critical to ensuring that schools can remain open. In addition, the communities and school model is such a critical component, and we have seen district after district continue to expand this model because of all of the critical wraparound services and supports that we know need to be in place to have a successful school. Also, as we talk about community violence, as we talk about youth engagement, one of the things the pandemic did, and it did it very clearly, was to show us how important schools are in making sure that our students and our young people are engaged and have a place to go. And so as we continue to not only move from reopening but to staying open, the Secretary is also very adamant about it's time to reimagine education, and reimagine education so that we can have as many young people see themselves in schools, see themselves with the teachers that they have, see themselves in the curriculum and what they're learning, so that they feel enriched and want to stay connected to school, and hopefully finish school and go on to have really strong outcomes and those opportunities that you mentioned for that young man. And so we are here this afternoon. I'll be listening to a group of school personnel as well as parents to really hear what the challenges and opportunities are for the future of education. And as my colleagues have mentioned, the information doesn't just stay with us. We present that information to the Secretary's leadership team as part of the reopening strategy, and also to the White House, so that we can actually bring voices from the field to the policy discussions and tables. And so looking forward to hearing from the Little Rock community this afternoon. And I'll turn it back over to Dr. Jackson. Oh, I'm sorry, Superintendent.
Thank you.
You're welcome.
Well, it's a treat to join this group of folks from all over our country and right here in Little Rock. You know, you look at this, our mayor has a phrase that says unity. That's what we're all about in Little Rock. The Little Rock School District has a phrase, said the power of us, and I think that everything that you're seeing and being discussed, it should fill us with a little bit of point of pride of what we do within Little Rock. Right here, an example, the Stephen Stars, okay? It's another example of what's right with Little Rock, a community school, a clinic, mental health support, and a leadership program tied to a Leader in Me. But it's not just here at Stevens, this is happening all over. What we've done since this pandemic is pretty amazing. You start to think about it in March, when we had to go shift. We had a meeting instantly with the mayor and his team to say, what are we going to do? And the very first focus was to make sure the kids got fed. And this community stepped up. Boy, did we step up. Clinton Center, our Cows Library, the Arkansas Hunger Relief Group, Little Rock School District, and the City of Little Rock put out more meals than almost any other community per capita. I'm proud of that. I'm proud of the fact that we also created medical camps so that our hospital personnel could be able to be taken care of, and that we had places for those students to go to catch up on their learning while the medical people were so tied up with the early stages of the pandemic. Our governor, I want to give him credit. He said in-person learning, and we've actually now had our second year of in-person learning, which really has an impact on what achievement's about and what support can be garnered for kids who are maybe struggling with all sorts of issues that are a part of life right now for many. I want to thank President Biden. President Biden, just for the Little Rock School District, $64 million worth of ESSER federal funds that have come in, that it's allowing us to go one-on-one with our technology, it's allowing us to handle the pandemic in thoughtful ways, and it's helping us with social emotional learning so that we can go support young people in really thoughtful ways. That's everything from training our staff to having aftercare programs to make sure that everyone is taken care of. The education component of this is really critical too. We have worked with the City of Little Rock, whether it's on expansion of our summer programs. We have the mayor that highly endorses that. The City Council has supported us with reading programs. This, again, is a formula that can be replicated other places, because sometimes we are so close to it right here in Little Rock, we do not realize the quality work that we have done. And that's why it's so neat to have these guests come in from DC and be able to say, wow, this is impressive. This school is impressive. This district, this city, we have some things that are going. We are not even close to being where we need to be, but we've got a lot of things going on the right track, and I appreciate getting to be a part of it. Thank you so much.
Thank you, Mr. Poore. The last person we'll hear from this afternoon is Dr. Smith with the Arkansas Department of Health.
Thank you. I'm Dr. Michelle Smith. I'm the Director of the Office of Health Equity and HIV Elimination at the Arkansas Department of Health. The mission of our office is to reduce disparities in Arkansas and ensuring vaccine distribution is equitable among minority and rural communities is one of our primary goals. In February of this year, we held our first Health Equity Community Clinic in Pine Bluff, where we vaccinated over 500 residents. Since that time, we have hosted over 90 vaccination clinics, vaccinating over 16,000 individuals in partnership with mayors and pharmacies across the state. The pediatric clinic that is being held today at Stevens is our first pediatric clinic in partnership with the City of Little Rock and the Little Rock School District. With our partners, we will continue to ensure that all children have access to the COVID vaccine in convenient locations such as their schools and community centers. Upcoming clinics are scheduled for Friday, November 19th at Bobby G. Lester Elementary in Jacksonville from 4:30 to 7 p.m., and Saturday, November 21st at Jack Stevens Arena at UALR from noon until 2 p.m. If you are a principal or administrator and are interested in having a clinic at your school, you can call us at 501-246-0127. Thank you.
We are truly grateful to all who have made today possible. Because of our limited time, we will not have questions on today. We will transition now to the vaccine clinic with our guests. Thank you so much for your presence today.